Hello, and thank you for joining us for today's webinar entitled Navigating Chronic Pain, Overcoming Barriers and Avoiding Pitfalls. My name is Chris Herndon. I'm an associate professor with the School of Pharmacy at Southern Illinois University, Edwardsville. I'd like to thank ScientiaCME for making this webinar possible. I have a few disclosures that I need to share. One is that I serve as a consultant for Premier Research Collaborative, as well as serve on the advisory boards for Endo and Incline Pharmaceuticals. We have numerous objectives today, but basically these objectives all center around the successful management of chronic pain, as well as how to manage or mitigate the risks associated with some of our more commonly used opioid analgesics. Pain can be defined as an unpleasant sensory and/or emotional experience associated with actual or potential tissue damage, or described in terms of such damage. This is the definition that has been put forth by the Taxonomy Working Group by the International Association for the Study of Pain. Pain is oftentimes referred to as the fifth vital sign because of the importance of routine assessment for this symptom. Pain, unfortunately, is incredibly prevalent in the United States. Looking at this data from the CDC and the NCHS, if you look at low back pain, those adults that had been surveyed of whether or not they had experienced pain in the previous 3 months, almost 1/3 of those individuals had reported experiencing some type of low back pain, and almost 1/4 of those individuals reported experiencing some type of neck pain within the previous 3 months. While pain is certainly an undesirable symptom, it can also be very disabling as well. Looking again at the CDC data, you can see that low back, knee, headache, and neck pain can all have very significant effects on not only basic actions, but also complex activities associated with the activities of daily living. Pain is also increasing. This is especially concerning because this data shows that pain is increasing in a rate that is not directly correlated with our aging population. As you can see here, not only are the people that are over the age of 65 reporting greater prevalence of chronic pain, but so are younger populations as well. Also concerning is that pain is a chronic problem. This table here shows you that those individuals that are reporting having experienced their pain for 1 year or greater, even though it's significant in the 65 years of age and older group, there are also individuals in the 20 years and over, 20 to 44, and 45 to 64 years age groups that are also reporting this. And on all of these age groups, that approaches 50%. Pain is incredibly expensive. If you look at the Institute of Medicine's report on relieving pain in America, the incremental health costs are somewhere between $261 and $300 billion. The cost of lost productivity is between $300 million and $336 billion, and the total estimated cost annually is $560 to $635 billion in annual healthcare costs. Another important consideration, not only in the costs of chronic pain, but another interesting artifact that came out of this report is that there tends to be quite a bit of disparate care associated with the treatment of chronic pain. For instance, racial and ethnic minorities, gender, even age discrimination can all play a role in the types of treatments, the types of medications, and the way that patients are followed up with, as well as how they present with their chronic pain symptoms. So the big challenge in the treatment of chronic pain is how do we make sure that we minimize the amount of symptoms that are experienced by patients experiencing chronic pain and mitigate the risks of overdose, abuse, misuse, and diversion of some of our more efficacious analgesics that we use. And this has really begun to become a growing problem in the United States. As you can see on this slide, there's actually been a staggering increase in the unintentional overdose deaths associated with opioid analgesics over the past 10 years or so. In fact, if you look at this data from the CDC, looking at unintentional overdose deaths, opioids, cocaine, and heroin, you'll notice that the deaths associated with opioid analgesic overdoses has actually surpassed that of cocaine and heroin combined. Opioid-related overdose deaths truly has become a public health crisis, and I think that this table here shows that very well. In 2008, there were 14,800 analgesic-associated deaths. For every one death that we experienced in the United States due to these medications, there were 10 treatment admissions for abuse.